that I attended this morning, that for several years since the devolution of health services in 1992, we did not have capital outlay in the hospital. So that is why the state of our public hospitals across the country is really dismal. We have overcrowding, we have dilapidated hospitals, and only recently, starting 2007, that we have capital outlay. What happened before? We can improve the hospital if there's foreign assistance. Yung mga donors natin from JICA, from other countries. But only 2007 nag-umpisa tayo, and we really lack a lot of resources for infrastructure, like 17,500 beds ang kulang natin to get to 1 bed per 1,000 population. So that's a big gap. But in terms of human resources, it's even bigger than the infrastructure gap. The comparison is Cuba. They have 1 doctor per 1,000 population. In the Philippines, we have 1 doctor per 33,000 population. So how can you detect the rare diseases? Yung mga common diseases nga, hindi mo ma-attend to. Now, there's really a lack of, shall we say, specialization. Like, number 1, we need 1 psychiatrist for every 50,000 population. But right now, our ratio is 1 psychiatrist for every 250,000 population. So no wonder marami tayong mental problems and mental illnesses. So what we're trying to do is yung ginagawa nga ni Dr. Padilla, force multipliers. So we train the psychologists to at least provide counseling and more or less screen and detect some of the mental patients. We train the frontline doctors, so multitasking na yung ating mga general practitioner. They can even give antipsychotics or the mental health drugs. Dati sa institutions lang yun. And, well, yun, anesthesiologist is another problem. So we're trying to address that. We're training nurses to be nurse anesthetists. We're training yung pathologist, problema rin natin yan. So we train even barangay health workers to be microscopists. At least they can detect malaria or they can detect tuberculosis kahit na hindi sila pathologists. So there's a lot of gaps in terms of human resources. But what we can actually do, yung sabi nga ni Dr. Padilla, actually identify maybe the nutritionist, the nurse, or even the psychologist to be a genetic counselor. Kasi we did that for the Women and Child Protection Unit. I was the one who started that. There was no such animal in Philippine health situation of a Women and Child Protection Unit for violence against women and children. And now we have a whole network of these facilities in the major hospitals as well as the LGU hospitals. So kaya nang mag-address ng violence against women or victims of violence and abuse across the country. So in that light, yun nga, we can actually do that and then identify it's actually a designation lang, and then we train people and then they provide the services. So medyo we have to adjust in terms of how we provide services. But the bottom line is really, we have to make sure that our people have access to services.